it is very true that as woman, as mother, you serve as like that center of the family. And I feel like there's a couple of things that can help us really, we failed mothers and for a very long time. The 6-week postpartum checkup is typically all a mother gets on her journey off into motherhood to make sure she's okay. 6 weeks, you're not even sure you're getting sleep yet. So some of the things we need to do really from a systemic standpoint is work on revamping the healthcare infrastructure so that we have more of these screening and checkpoints in with mothers from a mental health standpoint. There's a lot of surrogate organizations that try to fill this gap. Mocha Moms is one where we try to have this support and sisterhood to bridge this gap of where we know mothers are not feeling supported and need someone to listen to them and hear their concerns and maybe even direct them to a professional that can address an item going forward. But we really should have this in place for all women and mothers who need the support as part of the healthcare system that's available. In addition to that, it really is a matter of education, which I'm so, again, thankful to see that New Jersey's leading on the forefront and getting this implicit bias and a few things out there to build the education. But unfortunately, at this point in the short term, a lot of us as mothers and friends and family members have to serve as, in the short term, as that our own informed consumer and finding out the information for ourselves, advocating for our family and friends and letting them know, because it's the information is out there, but you have to know that that is there. Understanding the red flags that could exist, knowing what, as Dina had shared before, what to look out for as far as sleeping patterns, your eating habits, things like that, that you may miss. Family and friends and loved ones can be that additional support to get you in the right direction. So those are some of the things you can do in the short term to really bridge the gap. But in the long term, we really have to focus on the changes that are going to be in place across the board and really move the needle here. And a lot of it is going to be around supporting legislation that's coming out. There's a lot of acts out there for moms, the Momnibus Act. There's the I forgot the acronym for, but it's MOMS. I think it's Modernizing Obstetrics and Medicine or something to that extent. So there's a lot out there that you can contact your local representatives or legislators to advocate for and support and let them know that this is more than just a women issue. It's a family issue. It's a society issue, because if we don't have moms and we don't have the women as our hub and our center of our families, we really do see the impacts quickly spread, where if mom isn't taking care of herself, children aren't getting to their preventative care appointments. They're maybe missing out on school because of sickness and illness and childcare, and it snowballs very quickly. So it's really important to take care of ourselves now by advocating, but also driving education and change for the long term. So that's really what I think is a key to getting us where we need to be, and really addressing the shortfalls in New Jersey, but across the US for how we've been failing our mothers and what we can do better.